So I want to actually take this opportunity. I actually made a video on like general introduction to what debridement is in surgery, where I told you guys that debridement is more of like let me say a patient has an issue. So as they have this issue, the wound has been there for a very long time. So you have some dead tissues that cannot be revived. So these dead tissues are usually overlying living tissues. So if you want those living tissues to heal faster, you have to cut off the dead tissues. So that's what they're actually known as, what, debridement. You understand? So there are different types of debridement. We have the sharp surgical debridement, you have the mechanical debridement, we have the autolytic debridement, we have the enzymatic debridement, and the one that interests me the most is the biological debridement. So let me just move you guys to the biological debridement. Okay, so I could grow some sterile worms in the lab. So I put these worms to your wound. The worms will eat only the dead tissues and leave the living tissues. Okay, so don't worry, we'll come back to it. So in general, you should know that we're talking about the types of wound debridement techniques. So debridement is basically the removal of dead tissues that have been damaged or probably have been infected. They cannot be revived, so you just have to just take them out, you know. So for the sharp surgical debridement, usually performed with the scalpel. See this, you know, scissors or curettes. Okay, usually done by trained personnel. You know, it's the fastest method, removes large amount of tissues that have died. So we usually do this when there's extensive necrosis or infection, when there's urgent need for rapid wound preparation, you know. So there's immediate results, precise controls, and the rest of it. So for the mechanical debridement, it's just physical removal of the tissue, and it's using techniques like what, wet to dry dressings, wound irrigations, okay, or hydrotherapy. So speed is moderate, depends on frequency of the dressing changes, you know. So and it's simple, it's inexpensive. Then for the autolytic debridement, you are using the body's own enzymes to be able to liquefy the necrotic tissues. You achieve it with occlusive or semi-occlusive dressings. It's slow, and patients cannot tolerate aggressive methods. Okay, that's when you usually use it, you know. Or maybe the wound has minimal necrosis, so you don't need to employ some other crazy methods, but you just use this one, right? So it's not suitable for infected wounds and require what, adequate perfusion. So enzymatic debridement now, you are applying the topical proteolytic enzyme, you know, to break down the necrotic tissue. So it's faster than autolytic but slower than surgical. So usually use it for wounds that have moderate necrosis. So advantage is selective and can be used with other methods. Okay, then the last one that interests me the most is the biological debridement. So you are using the sterile larvae. Okay, they'll secrete enzymes and they'll dissolve the necrotic tissue and ingest the bacteria. So speed is very moderate, and you use it when there's chronic and wounds that are not healing well, you know, all those diabetic foot ulcers, pressure ulcers. Is highly selective, reduces bacterial load, stimulates healing. Okay, so this is what we got for the different types of wound debridement techniques.